Driving after a limb amputation represents more than transportation. It symbolizes independence, confidence, and a return to everyday life. For many individuals, regaining the ability to drive is a powerful milestone in the recovery process. While the journey back to the driver's seat may require adjustments, planning, and professional guidance, safe and independent driving is often achievable with the right support. The first priority after an amputation is healing. The body needs time to recover, build strength, and adapt to changes in balance and coordination. Before considering driving, it is essential to receive medical clearance from a healthcare provider. Physicians evaluate physical stability, reaction time, medication effects, and overall readiness to operate a vehicle safely. A formal driving evaluation is often recommended. Certified driver rehabilitation specialists conduct comprehensive assessments to determine a person's ability to manage vehicle controls. These evaluations measure coordination, muscle strength, range of motion, cognitive function, and reaction time. The goal is to identify any physical limitations and recommend appropriate adaptations. Adaptive driving equipment plays a key role in restoring independence. For individuals with lower limb amputations, hand controls are commonly used. Hand controls allow drivers to accelerate and brake using their hands instead of foot pedals. These systems are customized and professionally installed to ensure safety and comfort. Additional modifications may include left foot accelerators, pedal extensions, or modified braking systems. The appropriate equipment depends on which limb was affected and how much strength and control remain. Each solution is tailored to the driver's specific needs. For upper limb amputations, steering adaptations such as spinner knobs or reduced effort steering systems may improve control. These devices allow drivers to maneuver the vehicle safely with limited hand strength or range of motion. In some cases, specialized prosthetics may support driving tasks, although this depends on individual comfort and medical advice. Vehicle entry and exit must also be considered. Swivel seats, transfer boards, lowered floors, and ramp systems can make entering and exiting the vehicle safer and more manageable. For wheelchair users, wheelchair-accessible vehicles with lifts or ramps provide greater independence. Professional installation of adaptive equipment is critical. Modifications must meet safety standards and function reliably under various driving conditions. Once equipment is installed, drivers receive training to ensure proper use. Practice sessions often begin in controlled environments, such as empty parking lots, before progressing to public roads. Building confidence takes time. Drivers may initially feel hesitant, especially after a significant physical change. Gradual exposure to more complex driving situations allows skills to strengthen steadily. Support from rehabilitation specialists, family members, and healthcare providers can ease the transition. In addition to adaptive equipment, accessible parking accommodations provide meaningful support. Individuals whose mobility is significantly limited by limb loss may qualify for a disability permit. A permit allows access to designated accessible parking spaces located closer to entrances. Accessible parking spaces are wider than standard spaces and include access aisles. These features provide the necessary room for safe transfers, ramps, or mobility devices. Reducing walking distance can conserve energy and reduce strain, particularly during early recovery stages. Using a disability permit responsibly is essential. The permit belongs to the eligible individual and may only be used when that person is present in the vehicle. Respecting parking regulations ensures that accessible spaces remain available to those who rely on them. Emotional readiness is another important consideration. Limb amputation involves both physical and psychological adjustment. Patience, determination, and realistic goal setting support a successful return to driving. It is important to focus on progress rather than speed of recovery. Regular follow-up with healthcare providers ensures continued safety. If physical conditions change, equipment adjustments or reassessments may be necessary. Safety should always remain the primary priority. Driving after limb amputation requires planning, adaptation, and commitment. With proper evaluation, customized vehicle modifications, and thoughtful use of accommodations such as a disability permit, many individuals regain full mobility and independence. Ultimately, the journey back to driving reflects resilience. Adaptive technology, professional guidance, and accessible infrastructure combine to remove barriers and restore freedom. While the path may require adjustments, safe and independent driving remains an achievable goal for many individuals after limb amputation. Through preparation, practice, and ongoing support, independence can be reclaimed. Driving once again becomes not just a task, but a symbol of confidence and opportunity. We hope this video helped answer your questions. If you need a handicapped placard or plate and want to avoid the confusion and long wait times, visit handicappedparking.com. Our licensed doctors are available online to help you from the comfort of your home, making the process simple and stress-free. Subscribe for more helpful information on disabled parking permits and leave a comment if you have any questions. Thanks for watching, and we'll see you in the next video.